Hi, this is Paul Barr with Hospitals and Health Networks. I'm in New York ahead of the 17th Annual Not-for-Profit Healthcare Investor Conference. We're speaking with Jeanette Price, a Managing Director with Citi, and Amy Yang, who's a Director. Why did you choose a theme for partnerships this year, Amy?
Well, here at Citi, we're proud to say that we're one of the leading strategic advisory firms in the healthcare space, have been for a couple of decades, actually. So in the course of our work, I think we can safely say that we've seldom seen a more interesting and active environment for partnerships and collaborations, whether or not they be more straightforward perhaps mergers and acquisitions or divestitures, or other kind of things in the collaborative space that we would say, things like joint ventures, management agreements, and clinical affiliations. So that was definitely one driver in terms of what we're seeing in the course of our work. Other than that, piggybacking off of the success of last year's conference, the theme of which was preparing for population health and consumerism, we wanted to focus on our consumer, if you will, and respond to their feedback. So we placed partnerships and collaborations on a survey that we sent out after last year's conference, and sought feedback in terms of what rank the choices would be. And partnerships and collaborations came out as a direct result of feedback from that survey, from the audience wanting to see topics under that theme.
Great. And so how has the conference evolved over the years?
Wow. Well, we're in our 17th year, and it has grown and evolved and changed in so many ways, I would say. But first I want to focus in terms of how it's stayed the same, in terms of how the American Hospital Association, Healthcare Financial Management Association, and Citi have remained very steadfast and dedicated to the original purpose of the conference. And that was, it was originally born out of crisis, out of kind of a capital crisis between not-for-profit healthcare institutions and finding an understanding from capital markets investors. And since then, we've just remained dedicated to the fact that the belief that not-for-profit healthcare institutions deserved and needed a forum dedicated to them, where they could be heard and understood and recognized, and ultimately, we hope, supported by capital markets, by the investors and lenders, rating analysts, and other constituents. So that's the way that it's really stayed the same, I would say, over the past 17 years. But in terms of how it's grown and changed, I think we've seen so many new entities enter the space, in the investor space, private equity, venture capital firms, coming into the audience, chief experience, chief information, and chief marketing officers really wanting to have a deep dialogue about consumerism and about retail ventures, kind of all across the board. And amongst our presenters, not just the big system providers, but small regional providers wanting to join the dialogue and maybe partner or collaborate with their larger counterparts. So, I think the result of that is that we've seen the conference more than double in size in the last decade. And it's not just about the agenda, as dynamite as we know it to be, and our presenters, who also are fantastic, but it's about being there for the 2 days and about being open to conversations in the corridors and the things that we've seen develop from those conversations.
Great, thanks. And Jeanette, back to the conference for the that's upcoming. What kind of partnerships are healthcare organizations forming?
I think the great answer to that is there is just such a wide array of partnerships that are emerging. The pressures of the changes related to the Affordable Care Act, to rising consumerism, to decreasing reimbursement have led health systems to be very creative in seeking out organizations with complementary strength to ensure that they are sustainable for the future and that they're essential in their markets. So I think we've seen partnerships in kind of three general categories emerge. We've seen a lot of horizontal partnerships of acute care systems coming together, everywhere from full mergers to informal partnerships. We've also seen an array of diversified partnerships, acute care systems coming along into partnerships with systems that are elsewhere on the continuum of care, non-acute providers. And we've also seen an emerging array of partnerships between acute care providers and payers. And again, all of those seem to be most successful where the organizations can focus on the key strengths that they bring to the table and align those in a way to achieve common goals.
And are they facing any kind of challenges as they're forming these partnerships?
Yes, there are a number of challenges out there to successful partnerships. There's always a question of control in partnerships, which is challenging when you have two organizations of equal size and strength. Very often the question comes up on who's on first and how do those organizations going into the future jointly make decisions. When you're putting together diversified partnerships of acute care organizations and non-acute care organizations, very often the nonprofit system will be the acute care system and the diversified organization is a for-profit organization. There's some challenges sometimes in bringing together those different cultures and operating models in a way that's effective to both parties. There's a whole third area of challenge, I think, in the regulatory environment, which regulators are very focused on antitrust concerns and how do partnerships impact consumers in the marketplace. And the interpretation of what is beneficial to a consumer, I think, is still evolving and often difficult for partners to interpret.
I could imagine. What other issues are healthcare borrowers facing these days?
I think this is one of the more challenging eras for not-for-profit healthcare systems. As Amy said, we started this conference because there was a breakdown in dialogue, I think, between non-for-profit investors, not-for-profit healthcare systems and investors. Mm-hmm. What's happened since then, a lot of the emerging needs for capital for healthcare systems have come for investing in for-profit ventures sometimes, have emerged in terms of investing in physicians or in IT systems. Those aren't necessarily needs that lend themselves to tax-exempt financing. So systems have had to learn to actively participate in taxable markets and often to reach out maybe to look at partnerships in equity markets. That's a whole new arena. So finding capital has gotten much more complicated. Aligning with physicians, I think, is very challenging for physicians, for health systems as well. Their world is changing. Physicians' worlds are changing very fast as well, and their reimbursement is getting devastated. So how the two providers can work well to provide quality care and what's the right model to do that, I think is a challenge for a lot of people. And finally, I think in the era of dealing with managed care, I said earlier there are partnerships evolving, but what's the best way to participate with payers? Is it in networks? Is it actually owning health plans? Is it in joint ventures? I think the jury's still out on that, and there are many different solutions in different markets that providers are working through at this time.
Okay, Amy, what about you? Do you see any other issues out there that are looming?
No, I mean, I'd agree with Jeanette. I mean, we could talk all day about all the different challenges that are underway for our health system management executives, but I think it's important to realize that, you know, they're ultimately still very committed to their missions about caring for their communities and providing care at a cost that's acceptable for people, and whether or not that's through partnerships or collaborations or working with physicians or developing their own health plan, buying a health plan, or selling a health plan. I think it's a complicated world, and we're seeing a lot of differences in opinion there, and not necessarily a consensus. So it's very interesting to see how best practices develop in kind of all areas of that spectrum.
Great. Well, thank you very much, Amy.
Thank you.
Thank you, Jeanette.
Thank you.
For Hospitals and Health Networks, this is Paul Barr.